This week, we're handling the problems to do with a bag of worms, which is a dilation of vein inside the testicle. So why would the vein be dilated in the testicle? Why is it more common on the left side? Essentially, the actual drainage of the blood supply to the testicle is slightly different between left and right. On the right hand side, it's an artery that actually drains into the scrotum and drains back directly into the inferior vena cava. On the left hand side, the drainage goes into the renal vein first and then into the renal cava. Therefore, as a result, on the left hand side, 90% of the swelling as a result of varicocele occur, and also that happens to 20% of general population and half of men who presented with infertility. So why is it important? Well, first of all, it's a bit unsightly. So for men who has a varicocele, it will look like a bag of worms in their testicles. Apart from that, it also will warm up the testicle. As a result, it will reduce the spermatogenesis. So the question is, for somebody who actually encounter problem with infertility due to male factor reasons, then is it worthwhile to do a varicocelectomy, removal of varicocele, in order to improve the sperm quality? Well, it's not so straightforward. In order for somebody to be very fertile, you need to have a sperm number of about 15 million per mil of ejaculation, 40% of them active, and 4% of them have head, neck, and tail in a complete morphology. So if somebody who's just borderline having infertility, then the varicocelectomy or the operation to reverse varicocele is very helpful in enhancing the number and the motility. However, if you started off with a very low number of count and also no number of motility, for example, if your count is less than 5 million and also your motility is less than 30%, forget it. There's no point repairing it, because that even your number has gone up by 1/4, you're still not making the marks. So in conclusion, the varicocele is very common. So the swelling of the testicle due to varicocele is so common that it affects 20% of men. But for men who suffers from infertility, you need to know where your mark is prior to making the decision for varicocelectomy. For the following week, we're going to talk about another type of swelling, and this is a swelling when you get a hernia. There are quite a few different types of hernia, such as umbilical hernia, femoral hernia, but the commonest type of hernia is called inguinal hernia. If you're worried about that, stay tuned for next week's Putting Dr. G on the Spot.